as far as what we're doing and what we're providing, the personal alarms are thought of as like a very simplified mobile phone that's set up to work in an emergency for someone. It needs to be really simple. So they have one button on it, and when you press it, it's able to contact a list of people that you trust, and it will call them one at a time until someone picks up the phone. So let's say I'm wearing one of our personal alarms that's a watch, and maybe I've gone out for a walk and I've gotten lost. Maybe I've had a fall. Maybe I feel sore in the chest, whatever it is. I just press the button. It'll then start to call the people that I care about and I know. I can then talk with them through the device. I don't need to pair it with a smartphone or anything. It works all by itself. And then we can address the emergency from there. They'll know where I am because it has the tracking. It's also got the automatic fall detection. So if you've had a fall, it will activate by itself. And a number of other emergency features. But the bottom line is we're trying to connect people who are vulnerable, that want to feel safe in those emergency situations, with people that they care about and know and trust easily.
Amazing. And so, and I'm probably a little bit naive around these products. Are there other products on the market that you must have an additional device to be able to use?
No, so the devices, the personal alarms themselves, all of the wearables that you have, like the watch or the pendants on the lanyard, they can also be worn on the clipper, on the belt, for example. They are independent. And the way they're able to work independently is because they have a SIM card. That's why they're kind of like a simplified mobile phone that's just made super easy. So as long as there's cell coverage and cell network, the devices will work.
Okay, fantastic. All right, that sounds awesome. And there would be quite a lot of people with disability who would require a device like this, or would feel that they need a device like this.
Yeah, I mean, I used to be a support worker before working with Guardian, and I had a number of clients. I work with particularly young males with ASD, and I'll do like independent life training skills and transport training. We'll do volunteering, and they wanted to be independent, and their family wanted that. But they didn't always have know what sort of tools to help build that. And so now working here at Guardian, I always think back to that, because those sort of clients I know would have benefited from it. So any sort of person with a disability that wants to feel independent and free, and their family who wants that independence and peace of mind, can benefit from it. So that all they have to do is just wear the device. Think of it like a seatbelt. You don't want an emergency, but you put it on every day. It's like that. Just really wear it, it's there, and then you can feel safe.
Yeah, and it's not, I mean, my thoughts immediately went to when you're out in public, but it's something that obviously can be worn if you're living independently at home. It's something that you could be wearing around the house as well.
Yeah, absolutely. I mean, particularly people who might be prone to seizures, or who are at a falls risk, who might have mobility issues, or even neurocognitive issues, where they might have issues in the home, just living their daily life. Like I mentioned earlier, that automatic fall detection can provide a lot of peace of mind. But yeah, in the home as well, of course, if you're needing help, it's just a matter of pressing the button to get in touch with those that you want to get in touch with.
Okay, so you've got so the falls detection, or the device itself will start calling, like you said, down the list of people that have registered in the initial setup, and so then that person would then make contact, either run around there or give them a call, or if there's if they know what the situation most likely is, they can then call 000.
Exactly.
Okay, cool.
So 000 can be called by the family and friends if they want to. We can even put 000 on that call list. So if no one's answering the phone, maybe they're all in important meetings or at the movies, whatever, we can have 000 as the last point of contact. Okay, so that sort of setup is what we'd call family monitoring. But some people might prefer to reach a 24/7 service that's always going to answer the phone. We'll call that professional monitoring. That is an option too. Okay, cool. So if they wanted to reach them, we'll just set it up a little bit differently. And that monitoring company can have all the important information for them. So any medical conditions that they need to pass on to 000, like the paramedics, they can have that on file, handy to pass over.
Wow. Okay, cool. All right. Well, that probably leads us into the next question then. So within the disability sector, who do Guardian Safety Pendants work with? What types of providers do you work with?
Yeah, so in terms of providers, of course, companies like yourself, Plan Tracker, anyone in NDIS related space that works with those sorts of clients. So some of the most typical, I guess you could say, titles and people with responsibilities would be the support coordinators, the plan management companies themselves, whoever might be managing that. and occupational therapists as well.
Beautiful.
So
Okay.
we do a lot of education, like now, for example, working with them so that they can understand us best, so that when they're talking to a client, doing their best to understand the client's needs, they can be aware of what's out there, so they can see a need and then go, oh, I have something that can help fill that need.
Awesome. Okay, cool. All right. And I know that when we were talking recently, you were telling me about some other products that Guardian Safety Pendants were investigating and actually offering as part of your service offerings. So do you want to tell us about some of the innovative stuff that you've actually got on your radar at the moment?
Oh, okay. So letting all our secrets out. So
yeah,
we've got the pendants, of course, that we have that you wear on the lanyard, on the belt clip, and the watch. We are actually working on a new watch from Finland. Really, really good tech. So good that the Australian system is a little bit behind with the network setup. So we're kind of working on that. It is on the horizon. But as far as you mentioned earlier, Justine, about in the home and wanting to feel safe, we've noticed that safety in the home is a big thing. So we've been looking at some fall prevention products in the home, like the shower mats, the shower chair, raised toilet seats, and all those sorts of things. And even most recently, automatic body dryers.
Wow.
So something that you go underneath it after the shower, it automatically turns on, it senses that you're there, and then when you leave, it turns off. Really automatic, simple stuff. So that's on the horizon as well. You heard it here first. It's quite exciting.
And that's interesting. And that's probably, this could be my naivety sort of shining through here as well. But would that potentially remove the need for a support worker to assist a participant to dry themselves coming out of the shower, and perhaps giving back that a little bit of, I guess you could say, dignity?
Absolutely. That's one of our things that the word dignity you mentioned, we hear that a lot, that people just want to have that dignity, as well as, like I mentioned earlier, independence and peace of mind. So if you can remove the need for someone to take care of something that they'd much rather do themselves, like drying themselves off after a shower, absolutely, we want to be a part of that process.
Beautiful. All right. And that's obviously where an occupational therapist would have quite a say about that as well, I would suspect.
And exactly. So they're about seeing that need there, listening to the client, and being able to fill that need. And so, like for yourself, working with as a plan manager, you understand that you want to understand the client as best as you can, so that you can understand their needs. And that's what we're about working with you and other places on, so that those needs are met.
Yeah,
that's the bottom line.
Beautiful.
Yeah.
And you're out of Western Australia, but you deliver and service nationally.
Correct. Yeah. So our home office, it is a family company here in Perth, WA. But yeah, we work with places all over the country, and we've also got a few, I guess you could call them like reseller stores. So you can see our products in person, at least one in every state. Some of the bigger states have multiple. So if people really do want to see them, they can see them in person. And for a list of those, you can see them on our website there on the contact us page. And we'll pop your website into the comments anyway, so so that sort of information is accessible as well. All right. So how then, Brady, do Guardian work with the different? Are you a registered NDIS provider? Correct. Yep. Amazing. So we're a registered NDIS provider, and so we work with clients that are manage their funds in different ways. And we often get a lot of questions about it. Sometimes we're a bit stumped and we have to come to people like yourselves to ask about it. I guess that's where you kind of jump in. So I mean, we work with all the different styles, whether it's self-managed, plan managed, NDIA, NDIS, and using the portal. It all gets a bit much sometimes, especially as it's continuing to develop. So from your perspective, I guess I'll hand it over to you. What are the different styles out there at the moment? Because we work with them all, but can you tell me and everyone about that? Yeah, for sure. So we provide NDIS plan management, and we also have a self-management app. So we support self-managers as well. And so there are those three different unique the funds management styles within an NDIS plan. You can have a combination of all three. You could have, you could have a portion being self-managed, a portion being agency managed, and a portion being plan managed. It's not at all unusual to see that. I have no idea. Yeah, you can. Wow. You absolutely can. There's different
there's different pros and cons to all of the different plan management styles. So you could say that self-managed and plan managed are probably the most related in terms of flexibility and having choice and control over how you use your NDIS plan. So an agency managed plan, there's not as much flexibility, especially in the core budget, which is where a lot of the guardian safety dependents services and supports would come from. But with a self-managed or a plan-managed plan with enough funding in there, if you needed to purchase a falls alarm or a safety pendant, but you had not actually discussed it at your access meeting because you weren't even aware that it existed, but it absolutely would benefit you as an NDIS participant to have access to one of these types of devices. As a self-manager or a plan manager, very easy to be able to make sure that you can purchase that support, and we can talk about that in a little bit more depth as well. So there are three distinct ways of managing your NDIS plan, but they can all appear in one plan as well. So that's where, you know, you do need to, if you want to learn more about those management styles, you can obviously look at the NDIS website, but you can also give us a call regardless of whether you're a customer or not. If you just need you just need to have that made a little bit more clear to you about what those management styles are, how they're the same and how they're different. We actually also have a sheet which will pop in our comments spot as well, which just outlines each of those different management styles and what you can expect to see under each of those styles. So yeah, very different ways of managing your NDIS plan. From a plan managed point of view, you have a lot more choice and control over what providers you might like to use. So you don't have to use an NDIS registered provider, which you would need to if you have an agency managed plan. You do need to observe the NDIS price caps, which self-managers don't necessarily have to do. If self-managers want to choose to pay more for a particular support, they can. They're not going to be funded more, but they can make that choice and then manage their plan accordingly. So essentially, they're the three different ways of managing your NDIS plan: self-managed, plan managed, and agency managed.
You kind of must have read my mind, because I was going to ask, what's the difference between agency and plan managed? Because I've heard that term thrown around, and I've also heard NDIA. Is NDIA?
That's agency? The same. Agency and NDIA
right.
Managed are the same. Yeah.
Okay.
So the agency managed way of having your plan managed, it does suit some people. Some people might only use registered providers. They might have a pre-existing, very trusted relationship with those providers. What the providers do in that case is that providers go in, they create what's called service bookings, and then they process invoices against those service bookings. And making sure that the customer knows that's what they're doing, right. But they do need to be registered with the NDIS to do so. Plan managed participants, their providers such as you guys would send us an invoice and we would do that processing, and then also make available balances, budgets, supports, all of those things to an NDIS participant as part of our service. I guess sometimes not the argument, but the way some people would see it is that if you have an agency managed plan, you might feel you don't have as much control or visibility over who's doing what, when and where, unless you're a very good user of the government's portal. So that just has that little bit of lack of visibility, whereas a good plan manager would make sure that you were aware of who's making claims, how much they claimed, when they claimed it, when it was paid, all of those different types of questions that you might want answered. So yeah, there is a lot of differences between the three management styles, and it really just depends on which way you want to go about it as to what you would choose. Most people choose plan management for the extra support that a plan manager can provide, and then also being able to access non-registered NDIS providers as well.
So if I was to go onto the NDIS and I'll suddenly need it for whatever reason, and I hear all those benefits of plan managed that you outlined, and I go, I want that.
Yeah.
I'll be going, okay, so what's the catch? Or like, what's the extra cost, or is the extra cost going to affect my plan? How does that all work?
So if you want to, if you're getting access to the NDIS for the first time, or if you're having a reassessment and you want to switch to plan management, All you need to do is make that clear with your LAC or your planner that you would like to use a registered plan manager for your NDIS plan. And you can do that verbally. You can use a request for plan management letter that we actually have at Plan Tracker, so you can show that you have physically handed over a document requesting plan management. You can also request self-management. Now, recently, in the last set of amendments, the government is now, and we haven't really seen it or heard stories of it playing out, but the government is risk assessing whether someone can be plan managed. They might be deemed too vulnerable to use a registered plan manager. And the same with self-managed. You have to be able to be a suitable person and have the capacity to be able to self-manage. So even if you request it, there might be situations where it is actually denied. But that also could be a way in which you could actually ask to have that decision reviewed. So you just request it. You ring your LAC or you ring the NDIS and you request plan management. And then it's actually funded in your plan. So there's no trick, no trap. It's funded in your plan. You're not penalised for having it. You don't lose something just to be able to get plan management. And a plan manager will receive a once-off setup fee for that plan, and then they will receive $104 or something like that a month to perform the plan management side of the NDIS plan for the participants. So that's a set fee. So there is no competition between one plan manager and another as to how much plan management costs. What you will see is a difference in service. What one plan manager has the resources to be able to provide to a participant and their family versus another plan manager who might view their job as being purely transactional. Process invoices, give a statement, don't want to know about anything else. And more that's not the case. There's a lot of plan managers such as Plan Tracker who are open and wanting to do that supported decision making, helping people exert their choice and control and be self-directed. So but then there are others who are very good accountants, very good bookkeepers, but that's it. And that's another decision that you need to make. Right. Yeah. Okay. So it's in that summary. You request it simply by asking for it and then making sure that you're heard. And then the price for plan management is something like $14.85 a year. That's with the setup fee. And there's no difference in price from one plan manager to the next. The difference is the level of service that you receive.
That's good to know. I didn't know there was a set fee between them. So it's just about the different service. And so I guess it's up to the participant to do the research and either themselves or with help to make sure they're finding the best place for them.
Absolutely.
And to confirm as well, making sure I understand, because we do have a lot of clients asking this sort of thing to us, that when they do want to go plan managed, there's no, let's say they have some sort of budget or whatever, it's not going to affect the amount that they can have for different things. And it's not coming out of their pocket. It's funded through the NDIS to pay you to help manage their plan.
Absolutely. It's funded under a category called improved life choices, choice and control. So no, it does sit in the plan itself. No out-of-pocket expense. You should not be expected to pay anything additional to a plan manager. Unless that plan manager is doing some like you're building towards wanting to be a self-manager. Some plan managers might actually provide some self-management capacity building training. And that's when you'll have a conversation. But even then it wouldn't be out of pocket. It would be coming from your NDIS plan. So no out-of-pocket expenses for using a registered plan manager.
Okay. You mentioned the ongoing costs that it is for the plan management. Another question that pops up is about the ongoing cost for our alarms. So to sort of double back now, we spoke earlier about the family monitoring and the professional monitoring set up for the guardian safety pendants.
Yep.
So we would charge depending on what sort of plan they want on their SIM card. So most of the time people would choose the $70 a year Telstra plan for family monitoring. If they wanted the professional monitoring, that would be an extra $25 a month or $275 a year. They get a free month if they pay a year in advance. So the typical plan would be $70 a year for family monitoring or $345 a year for professional monitoring, just under $1 a day. So how does the NDIS support covering those ongoing costs? Like, let's say they were plan managed with you. Can they cover the cost, and how does that all work?
Absolutely. So it's a little bit, sometimes not as far as Plan Tracker is concerned, but it is a little bit tricky sometimes what is considered a prepayment. But we certainly do pay for the ongoing monitoring of a device that we probably would have funded as well, because it's quite clearly disability related. As there's only a couple of things that we'd need to tick off. One is that the invoice covers the plan period or short of the plan period, so it doesn't actually cover across dates that we're not in control of necessarily. But we do absolutely have a conversation about how to make it work, and we make sure that it happens. So all that would happen is that Guardian would send us an invoice and we would make that payment. Self-managers can go in and make those payments themselves. And yeah, as an agency, as a registered NDIS provider, you guys would go in and make those service bookings and make those payments to yourselves as well. So yeah, no, we would definitely work with you in terms of the ongoing monitoring, the annual subscription, I guess you could say, for the ongoing monitoring of that device, because it's quite clearly a disability related expense. Yep, yeah. Absolutely.
Good to know. Yeah, because I mean, the device is not going to be very helpful if they can't cover the SIM card costs. I mean, exactly. Yeah, it needs a SIM card to connect to get the help they need. Okay.
Yeah. Yeah.
So let's say someone, you know, going back again now, let's say that they're wanting to get a personal alarm from the get-go. They're like, great, this is what I want. So how can they access that through their plan? What are the sort of steps involved in going from, this is something that I want, I'm on the NDIS, where do I start?
Yep. Okay, cool. All right. Well, we were talking just before about, and offline actually, we were talking just before about the cost of the Guardian Safety Pendant, and you were saying about $519 for the device. Yeah.
$519 for the device. Yeah.
For the device. Yes.
Fee. You pay the $519. You own it.
Beautiful. Yep. So what that means in terms of an NDIS plan, there's a few different rules that are in place. So one of the rules is that the product that you provide is considered assistive technology. We probably should have said that in the beginning. Right. I should have said that in the beginning. So that product is considered assistive technology. It's also considered a low cost piece of assistive technology because it's under $1,500. So what that means is that you can actually purchase this device out of your core budget if you've got a core budget. And you know, a good percentage of NDIS participants have an amount in their core budget, and it would come out of your consumables part of your core budget, and it's very easy to be able to make sure that you can access that, especially as a plan managed participant. So when you're looking at about $519, what I suspect Plan Tracker would say to the participant is, we know that you want to purchase this, and we want to be able to tick off that it is a reasonable and necessary support. And so what we do is we provide the participant or the nominee or the support coordinator who can support the participant to do so. We provide what's called the My Choice tool, which is the 7 guiding questions that are in the self-management booklet about how to spend my NDIS funds. And if you can tick off all of those tick boxes, safety, disability related, low cost, et cetera, will help you, achieve your goals and your aspirations. Coupled with a letter of recommendation from an occupation, probably an occupational therapist, maybe a physiotherapist, we would process that with your invoice and it would be done, finished. Here's your device. Because it is around the $519, well, it is $519, we would ask for that letter of recommendation from an occupational therapist. We are very mindful of making sure that participants' funds are protected and spent, in a mindful way, and so we wouldn't, ask after every single piece of low-cost assistive technology that a participant might like to purchase. We wouldn't say go and get a $200 letter of recommendation to accompany this. But for some of those, higher value pieces, we would probably just ask for a little bit more evidence. That evidence could already exist. We might not need an extra letter of recommendation if the participant already has an occupational therapist functional capacity assessment on hand that they had to use for their access meeting, and it mentions things like safety or independence going out or risks of anything. We would use that. We would just ask for just another little piece of a document of some sort to support that purchase, and we support a participant or the family to be able to do that. So super easy in terms of how much the product costs, in that it can absolutely come out of a core budget with no approvals, no official approvals from the NDIS. Yeah,
Right.
so super easy. Probably
That's
made it sound
great.
hard, but it's not.
Well, it sounds like you're trying to reduce the hurdles by avoiding duplication of
Mhm.
like, the approvals and letters. Just have what they like from their access meeting, making sure that it's reasonable and necessary, which is super easy. Those
Yep.
boxes to tick, it's all sounds like it would fall under it. And they're wanting something to help them feel independent. So of course, they'd consent to have their information shared and everything goes through
Yep.
nice and smoothly. That sounds great.
Absolutely. Yeah.
Yeah.
And that's the thing, like if the device, an occupational therapist rings up and wants to, for whatever reason, wants to purchase the device for a participant but calls us independently, we're as plan managers, we're not going to have a conversation with someone who doesn't hold consent to share information with us as well. So it's really important to know that nobody, Tom, Dick or Harry can't go in and make these inquiries and purchase these things on behalf of a participant. We do need to make sure that those consents to share are in place because privacy is paramount to us. So yeah, just an important little piece to note there. So yeah, have I answered your questions? I often feel like I just go la 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 and then haven't actually answered questions.
Yeah, no, I think you've answered them all. There's nothing else that you touch base and everything. That's great.
Awesome. Okay, cool. All right. Oh my goodness. And we're keeping to time as well. This is amazing. All right. Perfect. So how can Guardian Safety Pendants be contacted, Brodie?
Well, so we're open Monday to Friday, 9 to 5 in Perth time. So our number is 08 6336 9448. And we have a lovely team that you can reach anytime during those hours. But if you prefer email, it's just info@guardiansp, S for safety, P for pendants.com.au. Of course, you can see that information on our website as well. If you forget, it's just guardiansp.com.au. And yeah, we'll do our best to help you out. How about yourselves? What's the best way for people to reach you?
Oh, look, we can be reached in a variety of ways. Our customer care number is 1-800-549-670 through our website. We also have launched live chat in the last few weeks as well. So instant responses to, it's working really well, actually. For people who don't want to talk, they just keyboard warrior their way through live chat. So so definitely through there. And email hello@plantracker.com.au through our Facebook. We can't hide. You can find us wherever you want to find us. You'll find us. We also, I might just mention, we are over in Perth on the weekend. We are attending and exhibiting the Source Kids Expo, which is a big expo, a big exciting expo. So if anybody is interested in coming along to the Source Kids Expo, it's running from 9 till 10 till 4 on Saturday and 10 till 3 on Sunday at the Perth Exhibition Centre. It's going to be super fun. There's always so much going on, so many activities for children to undertake, and lots of different providers for parents to come and have a look at, have a chat with. It's a bit of a one-stop shop for any sort, well, for the disability sector and for families. And we also have might be good to note right now as well, because we've got about 30 seconds. We've got a Geelong participant forum happening over in Geelong on the 3rd of November. And that's in conjunction with Cameron Wellness Centre, Gateways, Mabel, and the local partners and community. So that's really cool as well. So please have a look at our Facebook page if you'd like some more information about the upcoming events in Perth or Geelong. And also watch this space, guys, for the next Facebook Live that we will be running with another awesome provider. Brodie, I'm so pleased to have met you. I think that your service is so fantastic. I love the fact that you're a family-owned company, and we really want to get around and support you. So if anybody is thinking that they might like to investigate particularly the Guardian Safety Pendants, please reach out to Brodie and the team, and and then reach out to us if you want to talk about how they can be funded. Thank you so much, everyone, for joining us today. We really enjoyed I've really enjoyed having a chat with you, Brodie. So
you too.
See you Friday morning anyway. So
yes, I'll see you then.
Take care, everyone. Thank you very much. Bye.